Okay, ladies, we know that if we're pregnant, we need to make an appointment with our OBGYN, but that's not the only time that we need to set up an appointment with the doctor.
Yeah, joining us now is Dr. Kim Cox with the Pocatello Women's Health Clinic with some advice on when it's time to make the call. So, Dr. Cox, when is it a good time to call your OBGYN?
Well, you know, we live in an interesting era where health is, first of all, very valued, but it's also very prevalent. People are quite healthy, and some people don't like to go to the doctor at all. Some people don't like to go to the doctor unless they're sick. But the actual better choice is to make the choice when you're healthy and look at the things that you can do to prevent disease.
Okay.
Now that's specific to each individual age group. So
The older we get, the more we need our checkups.
the older and the more extensive the evaluations are to prevent cancer problems and other diseases. But it applies to young women also. Teenagers, especially if they're sexually active, need to be screened for sexually transmitted diseases. There are vaccines that can prevent many diseases. We need to make sure that we institute those. Women in middle age need to make sure that they are doing things to maintain their calcium, maintain their bone density, maintain appropriate weight, and are setting patterns in their lifestyle that will carry them into advancing years with as good a health as they can. And that comes from not going to the doctor when you're sick, but going when you're well for routine visits.
Okay, that's a really good point. Now, for women, a lot of times, you know, we get busy. We're not thinking necessarily of, you know, doctor visits and that sort of thing. But sometimes we'll have something that just kind of makes us stop. What should women do if, let's say, their cycles have been irregular for a certain period of time? At what point should they go to the doctor for that?
Well, certainly if you have been without a period for 3 or 4 months, most women by then will have already checked a pregnancy test. But clearly there are some either medical or hormone issues that may be influencing whether or not you have a period. And if you go that long without having a period, then the opportunity or the situation develops that you can have some heavy, very irregular and disturbing bleeding that you can't really predict. So it's better to intervene ahead of time, find out what's wrong, get it treated before you're placed in an uncomfortable situation with white pants on in a restaurant that you have to try to recover from.
I think ladies all have experienced situations like that. So 3 to 4 months is a good time to say, hey, let's get this checked out then.
Well, really, you should be intervening. It depends on your usual menstrual pattern.
Okay.
But if it is certainly twice as long as what your normal cycle is, and you don't have a positive pregnancy test, it's a time to begin paying attention, and then within a relatively short period of time after that, seeking intervention.
Okay.
If you are, let's say you're visiting your OBGYN and you have a good relationship with your doctor, is it okay to talk about things like common colds or things that may not directly relate to an OBGYN?
That kind of depends on your OBGYN.
Okay.
Some OBGYNs see themselves as specialists. Some OBGYNs see themselves as primary care doctors for women. Some of us try to span the whole gamut and not only do primary care for women, but also do high-risk OB and surgery. So it kind of depends on your perspective. Your OBGYN may send you to a family practice doctor to have non-specific women health-related problems taken care of. Others will be glad to see you for vaccinations, smoking, counseling, common colds, thyroid problems, those kinds of things.
So ask your doctor and find out what their particular philosophy is.
Yeah.
Okay, very good.
All right, Dr. Kim Cox, thank you so much for coming on the show today.
Pleasure being here.
And coming up next, we'll take a look at some of Hollywood stars that just never seem to age. It's not fair.